So today we are here for the regional launch of the Lancet SVN. What does SVN mean to you? Small and vulnerable newborn. And this means all the newborns who are born either early, preterm, or low birth weight, small for gestational age. And as we talk to you, there are every fourth neonate is either born too early or too small. And this actually constitutes SVN, small vulnerable newborns. Why is this important? This is important because this carries a lot of mortality as well as morbidity. If you consider the entire mortality that is associated with neonatal life, I guess it's more than 60% of neonatal mortality which can be attributed to SVN. And that's why it's so important. It's also important because we now know that more than 60% of all these SVN happen to take place in this part of the world, Southern Asia. And that is exactly why we, people living in this part of the world, we need to think about how we can contain this huge problem. And I think that's exactly why the Lancet decided to come up with this series of papers. Very authoritative, authentic, scientifically driven papers. I went through them, and today we are going to hear about the succinct messages that are conveyed through the papers in the series. And today, before I go on to talk about the guests that we have, I want to talk about you who have taken all the time to come to ICDDRP early morning. And I can see our great teacher, one of the greatest pediatricians of the country, Professor Najmun Nahar. She also thought that it was important for her to come and join this event. Madam, thank you very much. Along with our great madam, I can also see many other distinguished guests coming from the academia of Bangladesh, guests coming from the different offices of the government of Bangladesh, and also guests from different universities as well as NGOs. I welcome all of you to ICDDRP, and I'm sure the entire day you will find the presentations, the discussions very, very illuminating. Today, as you can see on the dais, we have several very important persons here. One is whom I consider to be a personal friend of mine. He's also a friend of Bangladesh as well as ICDDRP, Professor Per Ashorn. Professor Ashorn is Professor of Pediatrics at the University of Tampere, Finland. But along with that, he holds so many other hats. He works closely with the World Health Organization, with other international agencies, and everything that he does is to see how women and children living in developing countries, they can be helped. So either be it in malnutrition, be it in maternal health or neonatal health, he is always there. Along with Per, we also have on the dais Dr. Ulla Ashorn, and she is also from the same university, University of Tampere, Finland. So I would thank them also for coming to Bangladesh and taking all the efforts, because they have been working to improve the capacity of our researchers. Right at this moment, we have two students. They are staff of ICDDRP, doing great research, and they are also enrolled in a sandwich PhD program in the University of Tampere. Both of them happen to be their academic supervisors. And I believe they are not going to stand there. They are also going to further supervise students from ICDDRP and perhaps maybe other. Also on the dais, Kerry Vasni, and she comes from the Children's International Investment Fund, which we all know as SIF. SIF is an international funding agency that also is supporting many, many important projects all over the world. And I'm very pleased to let you know that the entire Lancet series on SVN that has been supported by several international agencies, notably SIF. And I would like to thank SIF, the Bill and Melinda Gates Foundation, as well as other agencies who have come forward. I would like to end my very small token speech here by again thanking all of you. And in particular, I would like to take the opportunity of thanking some of my colleagues. It was only a couple of months ago, several months ago, in fact, when Per approached me whether we can have this launch, and then I passed on the baton to some of my colleagues. And the most important colleague happens to be Dr. Alam. And it's very difficult to work with me on such issues, but he bore with me. And today you can see everything is in its place. Dr. Alam, working with his colleague, Dr. Shafiqul Amin, and two of my very close colleagues, Tanzila Ghani and then Rajasri Chakraborty. They worked day and night to make this successful. And we are also helped by the facilities management of ICDDRB as well as the engineering section. You can see that the auditorium looks nice and that has been renovated, in view of this very important launch. So I would like to thank all of them, and I wish a great success of this event, and I'm sure, like me, you will also enjoy this occasion. Thank you very much. Assalamu alaikum.
Thank you, sir. At this time, I would like to welcome Dr. Per Ashorn, Professor of Pediatrics and Director of Tampere Center for Child, Adolescent, and Maternal Health Research, Tampere University, and the lead author of the Lancet SVN series, to give a background to the regional launch.
Thank you, ma'am. Dear Tamid, dear colleagues and friends, thank you for your kind introduction and the invitation to attend this wonderful symposium. On behalf of the whole Small Vulnerable Newborn Consortium, I would like to thank everybody at ICDDRB and our friends in Bangladesh for organizing this event, which sort of marks the beginning of a series of 4 similar symposia. And with your permission, Dr. Tamid, I would like to give the audience some background as to these events, with the hope that it also clarifies the aims for today. It all started about 4 years ago with some researchers, supported by Children's Investment Fund Foundation, SIF, got together in London to discuss a problem of low birth weight, which we knew was common. And our aim was to provide SIF and other interested stakeholders with evidence-based advice as to what could be done to prevent the birth of too small infants. Now, over a period of a 2-year event, it became quite clear that it's difficult or even inappropriate to only consider low birth weight without considering its 2 driving pathways, meaning too early delivery, preterm birth, or fetal growth restriction, which you see in a child as a child born as small for gestational age. These 3 constructs, in many ways, indicate similar vulnerabilities, although slightly overlapping, slightly different considerations. And they form a big problem. And we also started thinking that wouldn't it be a good idea to actually synthesize the knowledge about the magnitude of the problem, its causes and consequences, and possibilities for interventions, and publish that in a scientific journal. A group then approached both SIF and the Lancet And when green light was given, 55 authors then sat on the forum and started working on what you now see in this picture or in my hands. It's a series of articles. We'll talk more about its contents a bit later, but you will see the key message in front of the booklet or the executive summary, which says that the fact that every fourth baby in the world is born too soon or too small is a concern, not only for public health, but also for human rights, national economy, and development. And by not addressing this issue, we are jeopardizing our collective future. Now, the researchers went on to make some proposals what could be done to reverse the course. However, working in offices in London or New York or even in Dhaka is a good start, and publishing things in the Lancet is a good start. But not everybody reads the Lancet. The ones who actually are working on hands-on preventive actions don't always read scientific journals. Also, what is planned in Finland or New York may not always be appropriate in rural Bangladesh, India, or Africa. And most importantly, scientists don't make policies and plan actions for practice. And in order to move what was a scientific publication into practical action, the authors of the series, the funder SIF, now joined also by the Bill and Melinda Gates Foundation, and the Lancet, proposed a series of regional launches and approached then respective organizations like ICDDRB and asked if we could form a collaboration on this. And I'm very happy and honored to now be a part of the first of these series. And so for today, the aim really is to move on closer to the action, listen to you and your thoughts. What are the barriers? What are the facilitators? And then hopefully to facilitate a process and pave a way to a world where every newborn has a chance to be healthy, meaning that they can survive and thrive everywhere. Thank you, Dr. Tamid. I hand it back to you.
Thank you, sir. Dr. Shalini Garg, Editor-in-Chief of the Lancet Regional Health Southeast Asia, will join us virtually to talk about improving maternal and neonatal health outcomes in South Asia, working towards the SDGs.
Thank you so much. It's a great pleasure to be here today. Can you hear me clearly?
Yes, we can.
Okay, so I'm Dr. Shalini Garg, and I'm the Editor-in-Chief for the Lancet Regional Health title for Southeast Asia. And I'm really sorry that I could not be with you all in person, but I'm thrilled that I'm representing the Lancet group of journals today. I would also like to thank Dr. Miriam Sabin, who led this fantastic series from the Lancet group.
Recording in progress.
So this series, as Per mentioned, was launched initially in South Africa in May this year. And at that time, regional launches were planned, keeping in mind the impact of these findings. I also noted that the image has been modified, keeping in mind the regional context. So I really appreciate that. As Per pointed out earlier, how this series came about and how impactful or how needed is this regional launch for us. So this series of papers is actually a renewed call to action to prevent babies from being born too early or too small, meaning that they are not vulnerable to adverse outcomes at birth or also later in life. So as Per has mentioned that they have, what they have tried to accomplish through this series and through their findings to coin a new term called these small and vulnerable newborns, who represent almost a quarter of all new births. So, and also they have given us a very nice framework to work on. So I leave it to the authors to illuminate more on the framework and the recommendations later in the day and through their presentations. With your permission, may I talk more about the Southeast Asian perspective, where 80% of all neonatal deaths attributable to SVN occur along with Africa. So the first thing that I want to point out, and I see it when we are inviting our mission work on different issues for our journal, for the regional journals, that lack of primary data that we have to depend on. And I understand how difficult it must be for the authors to model the estimations for future projections. And we know that the investigator-led series studies are not often sustainable over a long period of time. So I hope that the authors bring forth this very primary point in discussion later today as how difficult it is to study important issues without reliable data. So coming back to this series that collates data on number of newborns dying of preventable causes and the framework to show us the commonality of pathways that lead to adverse pregnancy outcomes such as low birth weight, small for gestational age, and preterm, and how we could prevent a very high number of these unfavorable outcomes by concentrating on action points during the entire life course of girls and women, and also through rigorous monitoring of the impact of our interventions and programs. So our journal, that is the Lancet Regional Journal for Southeast Asia, this month for August issue, we dedicated our editorial to maternal and child health because maternal and child health is a priority area for publication at our journal. And we have alluded to specific problems related to Southeast Asia. Some research, some of the studies that have highlighted gaps in the care continuum. So I'll invite all of you to take a look at our issue and look at specific problems to Southeast Asia. So the Southeast Asia region, the WHO Southeast Asia region, reports a very high maternal mortality ratio of 152 deaths per 1 lakh live births, an under mortality ratio of 32 deaths per 1,000 live births, and a neonatal mortality rate of 20 deaths per 1,000 live births in 2019. I hope you're all aware of these numbers, and I know these are shocking numbers. But the good news is that a large number of these maternal and child deaths remain. One of the studies from Sri Lanka that we have published in our issue this month, it is on heart disease complicating pregnancy and its outcomes. And the authors have elaborated what is the appalling scale of burden, which is totally preventable. And they have called upon the program designers and implementers to work on various time points across the life to averse this travesty. So actually, to prevent maternal and child mortality, as the authors have said, that the key focus should be on addressing women's vulnerabilities during the preconception period and pregnancy. Because these vulnerabilities not only impact a woman's own health, but are also transferred to her offspring, leading to increased risk of preterm birth and fetal growth restriction. So it's important to take care of women during the antenatal care. In 2020, 1 woman died every 2 minutes from preventable causes related to pregnancy. Some of the risk factors we know, like anemia. The GBD study has pointed out that one of the major risk factors is most prevalent in South Asia and Africa. We I'm happy that we have made substantial progress in reducing child and maternal mortality in the region of the past 2 decades. And a lot of effort has gone into this, keeping in mind the Millennium Development Goals. But the current rates of progress are insufficient to achieve the SDGs. And quality of care remains a major problem. One of our commissions on high quality health systems, the Lancet Global Health Commissions, showed that 66% of all deaths amenable to medical care in India occur because of poor quality, not because of non-utilization of care. So while we are celebrating that the coverage rates of ANC have increased to 75% in recent years, the effective coverage is very low. And that means that there are deliveries occurring in facilities without the capacity to handle maternal and newborn complications. One of the studies in this issue of our journal has actually taken the data from National Survey, and they point out that we might be losing out on many of these vulnerable children because we are guiding women to health facilities that lack life-saving services, because our determination of risk or the risk stratification system may be a bit flawed. So these and many more issues will be discussed today by authors and other eminent researchers present in the hall today. What I want to emphasize is that, that taking action now is really paramount to create a thriving society. As per mentioned, that where women and children flourish, and that results in healthy individuals, families, and societies. And so this series of papers could not have come at a more opportune time when we are setting our sights at 2030 SDGs. And we know that some of the countries, including India, might not be able to reach the targets given the recent slump in progress. I hope that these regional launches help in gaining momentum required for the last leg of efforts in achieving the SDG targets. I also look at this as an opportunity to propel local research in the field and come out with our own solutions and recommendations. So I end my presentation here, and thank you so much for your patient hearing. Now have a good rest of the day, and I hand back to the organizers. Thank you.
Thank you, Dr. Garg. We will now take a short 15-minute break. We have arranged for some light refreshments just outside the auditorium.
want that one.